Hey everybody, welcome back to my channel. Today we've got Jeremy again. He's back to talk about money stuff, right?
Yes.
So last time we had Jeremy on, we were talking about the cost of dentistry, and today he's going to kind of walk us through financing options.
Absolutely.
And Jeremy is over here at ASAP Dental. He's at the 103rd location. They've got 8 locations in Northeast Florida. They provide same-day smiles 7 days a week, and they're the official dentist of the Jacksonville Jaguars.
Yes,
He's
absolutely.
all decked out in the apparel, so we got to
Representing.
represent for our city, right?
Absolutely.
So if you want to learn more about ASAP Dental, make sure that you check out the description box below and visit their link and set up your free consultation. Okay, so dentistry can
Yes.
be expensive sometimes.
Absolutely.
Right?
Kind of like what we talked about last time. So naturally, to me, the next natural step would be talk about payment plans, how we can offset the patient's initial out-of-pocket expense.
Right, especially if it's somebody that's like avoided going to the dentist for so long.
Absolutely.
And they've let the whole issue kind of spiral out of control.
Right.
Now they finally mustered up the courage to go,
Right.
and they get in there and it's like, surprise, you have to pay like $15,000-$20,000 for restorative work or for implants, dentures, you name it. So what kind of options do you guys offer here that would minimize the patient's upfront costs? Say they don't have it all at once,
Absolutely.
but they can make payments. What do you
Absolutely.
offer?
Absolutely. That's one thing I love about us at Alpha Dental Management, ASAP Dental Care, is the amount of payment plans that we offer our patients. You know, we have 3 different types of payment plans. My experience with patients, they're here, they have a dental need, they really want to take care of it. Least we can do is have several options to help the patient be able to minimize their upfront cost. So we'll kind of go through those 3 different options that we have. Everything's based on credit, obviously, when we talk about payment plans. So everything that we do here is run as a pre-qualification. So if there is a denial, you don't have that hard pull hit on your credit report. Our top kind of tier, we use a company called Lending Club. They are the company that's going to give the patient the most amount of money potentially. When I say that, they can $30,000, $35,000, $40,000 they could approve for. The other good thing about Lending Club is it's no money down and there's no interest for up to 2 years. They also have different variations of interest options from 3 to 5 years. Again, everything's dependent on the patient's credit profile, but again, 0% interest, no money down for up to 2 years, depending upon how much money that patient is spending. Outside of that, our middle program is kind of care credit, no money down and 12 months, no interest. They can go 2 to 5 years, anywhere from 15 to 18% as well. And our backup option, the one I'm probably the most proud about, that we brought on October of 20 is a company called Sunbit. With Sunbit, you really only have to have a debit card. Sometimes there's down payment, sometimes there's not. We just scan the patient's license. It's the easiest application. Well, sometimes that patient, say, doesn't have the down payment for that work today. We actually have the ability with Sunbit, while you're in the chair, say you're the patient, I could send that pre-qualification link to any family member, any friend of yours, and they could actually pre-qualify right there while we're on the phone. And then we actually have the ability, if they say yes to that and get pre-qualified, I can send them the same checkout link and they can do it on their phone. So that person could literally be in California and would never have to come in to sign anything, and we could do it over the phone.
Wow, that's awesome, because you know what? That I actually experienced that when I finally did go and get my dentures. I didn't have good enough credit. I was very young. You know,
Right.
I hadn't even really established credit yet. And then
Definitely.
the credit that I did have, it was not the greatest.
Right.
So I couldn't qualify for anything. And my mom had to apply, and she was approved, and I just made the payments to her.
Absolutely.
So sometimes you got to do what you got to do. You know what I mean?
Absolutely. And again, we have that option to, again, with Sunbit, it's phenomenal. I mean, they approve over 87% of our patients.
87%.
87% of our patients.
That is incredible, because you know
Absolutely.
what? If that option was available to me before things spiraled
Yes, ma'am.
with my dental condition, I absolutely would have done everything I could to make that payment, but I just was never given that opportunity. So that's just amazing that people have the opportunity to get approved for, you know, whatever it is.
Yes,
Even
ma'am.
if they don't need dentures,
Right.
even if it's just, you know, you need an extraction, or you need, you know, a filling or
Yes.
something like that to prevent your, you know, the need for dentures in the future. But if you find yourself needing dentures, that's something that's an option for them.
Absolutely.
Okay, so those are your 3 financing options here.
Yes.
What other options do you have for patients that are not insured?
Great question. So a few years back, we were seeing the same thing. Half of our patients are uninsured. So we wanted to come up with a way to offset their out-of-pocket, but more importantly, focus on prevention. We fix a lot of teeth. We are absolutely amazing at fixing teeth, but our goal is to practice through prevention. We know there's a way, if we can fix things, get a patient on a good cleaning schedule, help them prevent needing any other dental work besides their cleanings. So that was the design about this program. So basically, You can come in 20 times for the year. All your exams and x-rays are going to be free. You're going to get 2 cleanings free throughout that year, and you're going to get 15 to 20% off any work that you do, and there is no cap. So a lot of times if you're doing, say, a root canal buildup and crown on a patient, it's going to pay for itself immediately. Patient comes in, maybe they pay for their exam up front, could be $100 something. If they do treatment that day and want to opt into the savings plan, we don't penalize that patient for paying for that exam first. We're going to give that money right back to them, and it's going to take off from the price of the savings plan initially. On top of that, any other additional family member is going to get a discounted rate to be able to opt into their savings plan as well.
Everybody's just trying to make it, and I thought that this was awesome that they would go over these things with us, because sometimes you just kind of sell yourself short and you think, I already know that I'm not going to get approved. I already know that my credit's not great. Trust me, I have absolutely been there, and rebuilding credit is not always that simple. Life happens, and it's just, I think it's awesome that there are opportunities out there for people to get the care that they need. And so I want to thank you guys for like sitting down and going over this with us.
My pleasure. Again, I just love talking about it. I've been doing this over 25 years, and if I can share some knowledge is power, especially in the dental industry, that can help anybody else out there, that's what I want to be able to do.
Absolutely. Listen, if you guys have any questions about anything that we talked about in this video, about any of the financing options, drop a comment below. Let us know what you've encountered. What questions do you have for Jeremy? Because he seems to be pretty knowledgeable on this stuff. And I want to make sure that you guys know what's available, and that you don't, limit yourself and deny yourself the treatment that you deserve to get just because you're not in the position that you want to be in. You will get there, but in the meantime, you need to seek treatment, and they've got options for you. So
absolutely. Worst case scenario, you come in for an exam, we go over all your options. Again, knowledge is power. So up until that point, then we can talk about payment plan options, and you can kind of make the informed decision from there.
So that wraps it up for today's video. I hope that this was helpful to you guys. Like, we're all in this together. I've been exactly where you've been. There's options out there for you. If you like this video, make sure that you give it a thumbs up and subscribe to my channel. Click the bell notification. Don't forget to check out ASAP Dental's link in the description box below. And I will see you guys again next time, and y'all take care.
See you guys later.